Discover KDH Collective's Leaning into Therapy podcast, an enlightening exploration of therapeutic approaches and evidence-based protocols. Join us as we delve into the vast landscape of therapeutic interventions, guided by the belief that collective intelligence surpasses individual expertise. Led by Katie Holmes, a licensed professional counselor with 16 years in private practice. This series offers valuable insights, expertise, and training from a team of skilled therapists. Prepare to immerse yourself in the world of therapy, created exclusively for therapists by therapists. Welcome to KDH Counseling's Leaning into Therapy. Today, you have me, Katie Holmes, the owner of KDH Counseling, and Amy Bordelon. She is a certified psychiatric nurse practitioner. So, Amy, can you tell? We're excited that she's here. We love her. Can you tell us a little bit about yourself?
Sure. Well, I chose to become a psychiatric mental health nurse practitioner because I kind of have a couple things that kind of hit close to home. ADHD, for one, struggle with that most of my life. And seeing how medications kind of turn things around for me just kind of opened my eyes into the mental health world. And here I am.
I love that because I think there is, specifically with ADHD, there's a lot of judgment in the world about that specific, the medications for that. And so,
Right.
but it is best outcomes, right? Therapy and medication.
Yes, together. They're both better
Yes.
together than either one alone. So, yeah.
I love that. And that the usefulness of it is what shaped you or kind of changed or made you want to become a psychiatric nurse practitioner.
Right. Just because I saw how medications changed my way of school for say, per se, like going from all over the place to being able to focus in one thing and just seeing how the meds improved that aspect of my schooling was kind of eye-opening and kind of always stuck with me. And I said, maybe one day I want to do that. And here I am.
I love that because I mean, you have your master's. That's, yeah, you were in a lot, you took a lot of school and nursing is hard. I mean, you
Right.
went through all that to get to this point, which, yeah,
Right.
the medication probably did help. So we are excited that you're here. And one of the things that we like so much about you is how personal you are, personable. I think when we were interviewing, you were kind, warm. There's this part of your personality that's not like authoritative, it's very open. And I feel like when people are getting medicine, that is a really important trait to have. It can be pretty intimidating to be in front of someone who is prescribing. What are they going to think? You know, all the things that people think. How are they going to judge me? Are they going to think I'm crazy? I mean, people think a lot of things in that position. And so having a warm prescriber can be so, so powerful. So,
Right.
can you explain your approach to medication? Like how,
Yes.
yeah.
Um, I like to take a collaborative approach with the clients. I don't like coming in and saying, this is what I learned, this is what we're going to do. I like to give the client all their options, make sure they know enough about every option so that way they can make an informed decision on how to proceed with treatment. So, pretty much the two of us together making a decision for the client.
Which
Not
is exactly why we hired you. And I did not know that that was your approach, but it's what we observed. So
Mhm.
interesting. Yeah. It's just who you are.
Yes, I think it's a good approach to have. It kind of makes the clients feel heard and understood and that you actually appreciate their input to their treatment. I mean, at the end of the day, it is their treatment. So,
Yes. And you need them to buy into it to want
correct.
to
Absolutely.
take the medicine, that you think might be best for them. So what ages do you work with?
Six it up. So, kids, adolescents, young adults, adults, geriatric as well.
How does that work in terms of like, what if a child comes? Do you try to get their consent for medicine?
I do. Just depending on how advanced the child is, just kind of breaking it down onto a level that they'll understand and just asking and, straight up, do you want to take medicines? With little kids, you never know if they could swallow a pill. So that kind of goes into play as well. So having their input is very important as well.
I love that. It's so relational. I really like that. I'm so glad you're here.
Thank
It's a,
you.
yeah,
Happy
it's
to be
a,
here.
I know. We're excited. What mental health issues do you typically treat?
My favorite is probably ADHD, depression, anxiety. Um, those would be probably my top three.
Okay. Outside of that,
Great preference.
what are other issues that people come in for?
Um, obsessive compulsive disorder, autism, different personality disorders, schizophrenia, bipolar disorder, just to name a
PTSD.
few. PTSD, absolutely, that's a major one. Yes,
No, I was thinking of major ones.
lots of trauma. Yeah.
I know. Yeah. Yeah, that's a complicated one. So, and I know we were saying we were going to mention there is a gene test that you suggest for clients. Can you tell us a little bit about that?
Yes, there's an oral swab that can be done that kind of helps the provider um, to see what medications you would best react to. It's not going to give you like a specific, this is the one that's going to do the trick, but it'll tell us, it at least guides treatment. It'll let you know, like, if you would start an SSRI per se, and they have some kind of gene variant where they may be at a higher risk of, side effects than another person would be. So it kind of just helps you guide treatment, what to be cautious with, kind of how to start your dosing if someone should be started at a lower dose because they're on these other types of medications that different interactions, I guess, is what I'm looking for, or even medications that they may not respond well to, just to totally avoid those medications. It kind of takes the guesswork out of our work because unfortunately everybody responds to medications differently, so at the beginning it is kind of just picking and choosing and hoping you pick the right one. I tell them don't get upset if the first medication we try isn't the right one. We may just switch meds a couple times before we find the right one. Hopefully, the first is the first, but it's
I
not always
love
the
that.
case, unfortunately. Yeah,
Well, yeah, and the collaborative approach is allowing for them to come back in and be like, "Hey, I have this side effect and I don't like it."
correct. Yes,
And you're not just going to say, "Well, keep taking it." You'll listen to
correct.
them, right? Yeah.
Absolutely. Yes,
But that test really can eliminate some of that from happening if
it
people are,
does. It
yeah.
does. I think it's a great tool to have in our, I think all clients should be able to have this test done. Unfortunately, insurances won't all pay for it, but yeah,
Oh, that's it.
it is.
Yeah.
Yeah, I
So
think it's a great tool to have under, you know, because it also helps with other medications, not just mental health meds. It does say like some medical meds, like cholesterol medications, pain medications. So it's kind of beneficial all around.
yeah, I want to get this test. I'm like, I like this. I like this. Yeah.
Me
Because
too. I think it's great.
I bet I have some weird side effects from certain meds. I bet yeah, it'll show up on there.
It
Interesting.
would. It would.
Also, doesn't it show the MUTHFR
Yes.
gene?
It's
Doesn't it?
MTHFR. Yes.
MT. Okay. MT.
MTH. Yes.
I'm bad at that.
Yes.
Okay. Tell us about that.
So this particular gene variant, individuals who have this particular one, their bodies have trouble breaking folic acid down into folate, which is the active form that your brain needs to make serotonin, dopamine, and norepinephrine. So if you don't have enough of that to make these, then your medications for mental health sometimes just aren't going to be effective. So all of your SSRIs, they require serotonin to be there for them to actually work. So individuals with the MTHFR gene may not have enough serotonin in their brain for these SSRIs to even work. So it kind of helps guide treatment as far as, hey, you might need to be on the L-methylfolate to, get your serotonin to where it needs to be so the medications can be effective.
So interesting. I love that. Is there anything else you want people to know about you?
Well, I've got availabilities.
Yeah.
um, I think my collaborative approach is something that clients really like. I'm not here to treat symptoms. I'm here to listen and figure out with the client how they want to go about treatment and determining what's best for them and getting them to feeling better.
I love that. And it's based on that open dialogue. So you
Correct.
create a warm environment but it's also that you're there to listen. You're not
Correct.
just there to like give them the medicine, you're listening.
Correct.
I love that. So
Yeah.
we are excited to have you here.
Thank you. I'm excited to be here.
We'll have more as time goes on. Bye.
Thank you so much for joining us for this episode of Leaning Into Therapy. If you'd like to follow along, you can catch our other episodes. You can also find more information about us as a practice at kdholmeslpc.com. Hope to see you soon.